Hi everyone and welcome to Easy Learning. So we are going to do another mock exam and let's search with the theme. Okay, I'm searching RBT mock exam free and we will be doing this one free RBT mock exam by Blossom Children's Center. We have already done this one and the video is available on my YouTube channel. Let's do the Blossom Children's Center one. Okay, so they have given a whole mock exam here and we can attempt it for free. And once we complete the RBT test, our score will be available at the top of the page. So, and another benefit of this mock exam is that we will get the correct answer right away. So, let's do it one by one. When preparing for data collection, a RBT should do all of the following except. Okay, so you have to look for the option which an RBT is not supposed to do. Identify the target or target's behavior. Yes, an RBT is supposed to identify that. Prepare materials prior to the start of the session. Yes, as we have already discussed this, that we need to have all the materials required before the session starts. Have a one-on-one meeting with the parents to discuss assessment results and goals. No, an RBT is not allowed to do these because these are to be done by the supervisor, and an RBT can be there. He or she can attend the meetings, but is not supposed to do the discussion on the results and goals in one-on-one meeting. Okay, review client's programming before starting a session. Yes, again, an RBT is required to do that. So what an RBT is not required to do is to have a one-on-one meeting with parents. Okay, so the answer is correct. Next one is your BCBA instructs you to take data on how many times your client engages in verbal refusals in 30 minutes interval. What type of data collection use? Okay, so you are talking about the number of counts here, and number of counts is frequency, but our answer is not frequency because we are also talking about the time interval. So, partial interval recording, no, it is not partial interval because you record the behavior as yes if it happens any time during the interval, but we are not talking about any time, we are talking about the number of counts. So count alone won't do the type of data collection we are required. And then rate, as we discussed, rate is frequency over time, so we need to know how many times in this much time. So we will be recording or using rate for data collection here. Your BCBA instructs you that she wants you to record how long your client's tantrum lasts. What type of data collection would you use? Okay, so whenever we are talking about how long the behavior has occurred, we'll be talking about the duration. We're talking about from the time the tantrum start to the time it ends. So we are talking about for how long it occurred. So it will be duration. Rate would be frequency over time. There is no how much or time we are talking about. We are not talking about time. And for whole interval recording, we record or mark the behavior if it has occurred during the whole interval. And latency is when the prompt is given, when the instructions are given, and then the behavior starts. The time between that would be latency. But here we are talking about how long the tantrum or the behavior lasts. 18 instances of the child throwing items in the classroom. What type of continuous measurement procedure is the RBT implementing? Okay, so we are talking about this much or this many times. So number of counts is frequency. If they have given us a time element with it, it would be rate. If they have told us the time that for how long the behavior occurred, it would be duration. And if someone has asked the child to throw and he started throwing, the time between that would be latency. But here we are talking about number of counts, so it would be frequency. The BCBA instructs you to measure the time between the end of one response to the beginning of same response. What continuous measurement procedure is being implemented? Is it latency? No, latency is the time when the instruction is given until the behavior occurs. So it is not latency. Whole interval is when the behavior has occurred during the whole interval. So it is not again the whole interval thing. IRT, inter response time. As you can see, inter means between and response. So IRT would be the time between the responses. And here we are talking about time between end of one response to the start of same response. So it would be IRT. Duration, no, it won't be duration because we are not talking about the response for how long it occurred. We're talking about the time between responses, so it would be IRT. All of the following are discontinuous measurement procedures except. Okay, so whole interval recording, there are three major types of discontinuous measurement procedures. One is whole interval recording, so it is a type, it's not the not type. Momentary time sampling is also a type of discontinuous, and partial interval is also a type of discontinuous. For whole, you record if the behavior has occurred during the whole interval. For momentary time sampling, we record the behavior if it has occurred at the end of the interval, and for partial interval, you marked it if it has occurred any time during the interval. So these three are the types. So what would be left? Inter-response time. It is not a type of discontinuous measurement procedure. Which measurement procedure is being used if the observer is recording if the target behavior occurred at any point in the interval? Okay, so we have discussed it when we were talking about the previous MCQ. It won't be interval by interval recording. We are talking about if it has occurred at any point. So if it has occurred at any point, it would be partial. Means it would have occurred somewhere between the time interval. For whole, it has to occur during the whole time period, and for momentary, the target behavior has to occur at the very end of the time interval. So the answer would be partial interval recording. A RBT sets a timer for 2 minutes. When the 2 minutes timer goes off, the RBT looks up immediately to see if their client is sitting in their seat. Okay, so we have to find out what type of data collection is it. Uh, so here we have a time interval of 2 minutes, and when the time ended, the RBT looked up and saw if the client is sitting in his seat or not. So what did he do? He checked at the end of the interval if the behavior occurred. And we said if we are recording the behavior, if it has occurred at the very end, it would be momentary time sampling. If the RBT would be recording or seeing the client sitting on his seat for the whole time period, it would be whole interval. And if he sat at any time during the interval, it would be partial. And again, it won't be latency because we are not talking about what the instructions were given and when the behavior occurred and all. So it would be momentary time sampling. The observer is recorded. The observer is recording data on tangible items. For example, completed math worksheets left over in the environment that can be recorded at a later time. What measurement procedure is being described? Is it event recording? No, we are not talking about what's happening, and we are not recording it. We are not recording the time period for how long the behavior occurred. Permanent product recording. Okay, so we are talking about the completed math worksheets which are left over in the environment. We can see them at any time. So it would be our permanent product because we can check them at any time. We can see them, we can see the final product. We are seeing a product, so it would be permanent product recording. And tangible count, no, we don't, it's not a technical term, so it would be a permanent product recording. When graphing data, dash is labeled the x-axis and dash is labeled the y-axis. Okay, so I forgot to record the part. uh, for the x-axis, remember that whenever we are talking about x-axis, we label the time period on this one, and as you can see, there is only the option of time in first one, and the other ones have the time option for y-axis, and the fourth one does not even have the option of time. So simply it would be the time as the x-axis and behavior to be labeled as in y-axis. The ABSCA refers to which axis on a line graph. Okay, so there are two terms which we use in ABA and in line graph. The one is ABSCA and the other one is ordinate. So these are the two different terms. So it can't be ordinate, it can't be coordinate also because we don't okay, so it's either y-axis or x-axis. So the y-axis is also known as the ordinate, so our only answer left is x-axis. X-axis is equal to abscissa and y-axis is equal to ordinate. Do remember this. What is the most common graph used in ABA? Okay, so as because we use line graph for the most of the time in ABA, the other graphs are also used, but the most one is line graph. Which term is used to describe anything an organism does that is observable and measurable? Okay, so something that is observable and measurable, and it's anything that an organism does, it would be behavior. This is basically the definition of one of the operational definition of behavior, that anything an organism does which is observable and measurable, it would be behavior. It won't be subjective, it won't be analysis, it won't be function. A BCBA is describing to the RBT the target response for data collection. He/she then describes the physical form or shape of the behavior. In other words, what the behavior looks like. The BCBA is describing the dash of the target behavior. BCBA describing function. No, the BCBA is not telling about the reason the behavior occurred. Okay, is he or she describing the event? Again, no, he's not explaining the whole event. He's only describing what the behavior looks like. Is it topography? Yes, this would be our answer because topography is how the behavior looks like, or the physical. Again, this is the operational definition of topography, um, that the physical form or shape of behavior or how the behavior looks like is known as topography. Again, it won't be chain. The RBT instructed the learner that it's time to go to the classroom to practice tracing lowercase letters. Once seated, the learner engages in elopement. Each time the RBT presents the instruction, let's trace. Based on the scenario and the four functions of behavior, what appears to be the function? Okay, so the So the learner is eloping, yes. He is escaping, yes. Is it automatic? No. It's every time the instructor is saying let's trace, then the behavior is happening. So it's not automatic. And is it attention? No. He's not looking for the attention part as he's avoiding the situation. So it could be either elopement or escape. But when we are talking about the four functions of behavior, remember that these are four. SEAT: sensory, scape, automatic, and tangible. The one appears here is scape. The RBT is working with a new client on identifying preferences. The RBT presents five items in front of the child, including a car, bubbles, train, a stuffed animal, and a puzzle. The RBT states to pick one, so the child chooses the bubbles. In the next presentation of the stimuli, the bubbles are taken out of the array and the other items are rearranged. The RBT instructs the client again to choose one. Which preference assessment is being implemented? Is it free operand? No. The RBT is presenting the items to the client. So it's not free operand. In free operand, the client is free to choose what options he or she wants, and the RBT only observes. Uh, is it forced choice? No. Forced choice is when the items are presented in pair and the client is supposed to choose from that pair only. So obviously there are five items, so it would be multiple stimuli. And which one? With replacement or without replacement? As you can see, the bubbles are taken out of the array and the other items are rearranged. Is no replacement of the items. So the answer would be without replacement. The BCBA gave the RBT 10 tasks to have the learner perform to assess whether the learner can perform the task or not. This is an example of, is it pairing? No, we have to assess something. It's not just about pairing with a client. Generalization, no, we are just assessing. We have not talked about any plan here or whether we need to generalize or even maintain it. But is it probing? Yes, probing is when we have to assess the whether the learner can perform the task or not, whether the learner has the skills to perform it or not. So probing is basically an ABA term in which we identify or assess whether the learner can perform or do something or not. Essential components of a written skill acquisition plan include all of the following except. Okay, so essential component of writing a skill acquisition plan. Identify a skill to teach and create a goal. Yes, you need to know what kind of skill you need to teach before making the whole plan. Modify the plan if necessary. Yes, you need to modify it if the client already has the skills or if the client is slow in learning or faster in learning. So you need to modify the plan accordingly. Identify a measurement procedure for data collection. Obviously, you need to have a measurement procedure for the data collection. Review data on average once every 2 months. Okay, so this is not the exact requirement for a written skill acquisition plan. First, the RBT gathered the necessary materials needed for data collection and program implementation. Next, the RBT spent 15 minutes before their session reviewing the updated behavior intervention plan and programming to prepare for their session. The RBT had two questions and reached out to the supervising PCBA for clarification before beginning the session. These are all necessary components of. Is it behavior modification? No, we are not talking about the plan of for the client. We are talking about what the RBT did here. And is it preparing for the session as required by the Skill acquisition plan, yes, this could be it, but like the other options also. Facilitated communication, no. Again, maintenance procedure and all these are all which are to be done with the client, but the RBT is preparing the stuff, is then reviewing and updating and also reaching out to the supervisor for clarification. So basically, he is or she is preparing for the session as required by the skill acquisition plan. And this is quite a good approach for following or carrying out a plan, a session. This describes a principle of behavior describing a response consequence functional relation in which the response is followed immediately by a stimulus change that results in similar responses occurring more often in the future. Okay, so we are talking about a principle of behavior here in which the response is followed immediately by the stimulus change, and that does what, it either it affects the future probability. Okay, so it's either increasing or decreasing or what. So we are talking about that results in similar responses, which means we are talking about something uh, that is increased in whose okay, so we are talking about something in which the future probability is increased. So we have added something and the future probability is increased, and I hope you know the answer by now, because adding something and which increase the future probability is reinforcement. Punishment is when it did not result or it would decrease the similar response, and it would decrease the target behavior actually. And replication, again, no, we are not talking about repeating it or there's no reflexivity. It is something added after the response and the future probability increase, so it would be reinforcement. John receives a token as a part of token economy every time he brushes his teeth before going to bed. This is an example of. Okay, so is he getting something? Yes, it is not negative because something is not removed. Is it punishment? Again, we are not talking about something. Uh, every time he brushes. Okay, so they have not given us whether the John started brushing his teeth more often in future. We don't know what happened after he's given something, so we don't know whether it was a reinforcement or punishment for him. So it would be none of the above. If they say that every time he brushed his teeth before going to bed, he received a token, and so John started brushing his teeth daily or in future. So we have given a solid evidence that the future probability increased or even if decreased, but we did not get enough evidence, so it would be none of the above. Sarah cleaned her room and received $5 upon completion. Sarah engaged in cleaning her room more often in the future. This is an example of, again, uh, it's similar to the previous one, but we have given more evidence that the future occurred more in that the behavior occurred more in future. So this would be an example of, okay, so the behavior is happening more, it's increasing, so it would be reinforcement. Whether it's is it positive or negative? Okay, so she's getting something is added and the future probability is increased. If something is added, it would be positive reinforcement. It won't be negative because she's getting something, anything is not taken from her to increase the future probability. This principle of behavior occurs when a behavior is followed immediately by the removal of a stimulus that increases the future frequency of that behavior. Similar to the previous one, again, future frequency of the behavior is increased. Whenever it is increased, it would be reinforcement, and we only have one option with the reinforcement here. But do know that if something is removed, it would also always be negative. If something is added, it would always be positive. If the future probability is increased, it would be reinforcement, and if the future probability is decreased, it would be punishment. Something is removed, it is negative. The future probability increased, it is reinforcement. Negative reinforcement would be the answer, which is an example of reinforcement. Technician providing their client with verbal praise and a token on their token board for picking up their toys when instructed. Okay, so there is no example whether the clients started picking up the toys more often in future or not. Technicians provided client with 10 minutes of gym time when using the bathroom, which increased the client using the bathroom more often in the future. Now they have given us a clear evidence of the behavior occurring more in future. This could be the answer, but let's go through the other one. The circle time leader handing out gold stars to all clients who participated in group instruction. No, the evidence of future probability is missing, and all of the above, no, it can't be all, because the first and third one are not the option. So our answer would be B. All of the following are examples of unconditioned reinforcers, except okay, so whenever we are talking about the unconditioned, it means they are not dependent. The behavior is not dependent to be learned here. Uh, So these are like the natural, or you can say the biologically reinforcement for organisms. Sleep, yes, a biological need. Food, water, again, are the biological need. But money is something that is learned to reinforce the behavior. Emily is working with her client on a new skill which involves emitting one word commands, especially requesting go when her client wants to leave a room. The RBT provides reinforcement for every occurrence her clients emit the target response. The RBT is implementing. CRF, okay, is it CRF? Continuous reinforcement. Continuous reinforcement is when the reinforcement is provided on on every correct response. And here the RBT is providing reinforcement on every correct. So yes, it is CRF. But let's go through the other. Reinforcement on a FR schedule. FR means fixed ratio, fixed response of 1, which means reinforcing on every correct response. Again, this is also same as CRF. So both are the answer, and discontinuous reinforcement, no, she is getting reinforcement for every correct answer. So it would be both A and B. Intermittent reinforcement is typically used to teach new skills, while continuous reinforcement is typically used to strengthen and maintain established skills. Okay, a big no. Intermittent reinforcement is when you provide reinforcement variably or in a discontinuous form, and this way the skills are more strengthened and maintained as compared to continuous reinforcement, because this way the client becomes dependent on the reinforcement and it's hard for them to strengthen and maintain these skills without the reinforcement. So the case would be opposite. If this would be false. Intermittent reinforcement basically strengthen and maintain established skill. Meanwhile, continuous reinforcement is used typically to teach new skills. A teacher delivers a student a break from independent seated work after exactly 1 hour since their last break. This is describing what schedule of reinforcement. Okay, so we are talking about time here, not responses. When we talk about response, we talk about ratio. So since we are talking about the time, it's either the fixed interval or the variable interval. One and the third option are already eliminated. Is it a fixed time period or a variable time? The question is that they are getting the break after exact 1 hour. So the time is fixed here. It would be fixed here. Yes. The BCB delivers praise 5 times on average for each correct response. Sometimes the BCBA delivers praise after 4 correct responses and sometimes after 7 correct responses. Based on this scenario, what schedule of reinforcement is being implemented? Okay, so now we are talking about the responses, and in the last MCQ we talked that whenever we are talking about response, we talk about ratio, and when we talk about time, we talk about interval. So here we are talking about responses, so it's the answer would contain the ratio thing. Okay, and here we have B and C with the ratio word, fixed ratio or variable. So there is no fixed number of response. The BCB is delivering the praise. He or she is not praising after every uh, four correct responses, after every single number of correct responses. Instead, different numbers, but the average is 5. Okay, so when the average is 5, but the main options are different, it is variable ratio. This type of teaching procedure involves short, quick intervals when learning skills that involve an ST, prompts, responses, and feedback in quick succession. Typically, many trials are run at the table. This describes which teaching procedure. Is it incidental? Okay, so incidental teaching and NET, natural environment teaching, are used in exchange of each other, and we are talking about the trials that are run at the table, not in the natural environment. So it's not incidental, it's not NET, and table time teaching is not basically a technical term here. So the answer would be DTT, in which ST, prompt, responses, and feedback are given, and many trials are run for it. Natural environment teaching focuses on all of the following except reinforcement is embedded into the task. Yes, we try to within the task or within the natural environment, teaching in natural context and settings. Yes, we do that. Highly structured approach with planning of session and controlled condition. We are talking about natural environment here. We are not talking about the contrived or controlled. So this would be our answer, that this is not a part of NET. But let's go through the last one. Focusing on the child's immediate instruct while looking for teachable moments. Well, this is a part of NET, so our answer would be C. What is pairing? The process of pairing is based on a stimulus-stimulus pairing. The process of taking a neutral stimulus and associating them with the established reinforcer. On stimulus-stimulus pairing, taking a reinforcing stimulus and associating them with the other established reinforce. If it is already a reinforcing stimulus, we don't need to establish it with other reinforcer. We don't need the pairing actually. The process of adding new toys into the child life by putting them next to them. No, this is not pairing. A highly structured approach to identify a learner's preference that should take place in one day. No, again, pairing is the when we are adding, we are taking a neutral stimuli and we associate it with established reinforcement, so the neutral stimulus also becomes a reinforcing stimulus. So this would be pairing. Laura, the BCBA, is working with her client on brushing teeth. She has broken down the complex skill of brushing teeth into smaller teachable steps to help her client learn this new skill. What teaching procedure is Laura implementing? Well, she broke down the complex task into smaller ones. So she is doing the task analysis of the brushing, and probing would be when she assess whether the client has the skill or not. Natural environment, no, we are not talking about within the natural environment on the natural context, and this is not a generalization procedure. We are breaking the task into smaller steps. Josh is an RBT working with a client on hand washing. Hand washing is a complex skill that the client's BCBA has broken into a sequence of small, teachable steps. Josh BCBA instructs him that the procedure involves Josh prompting all but the last step in the behavior chain, which is performed by the learner. then receives reinforcement for completing the chain. When the learner shows mastery in performing the last step, Josh will then complete all but the last two steps in the behavior chain, and reinforcement is delivered. This sequence continues until the learner completes the entire chain independently. This describes what teaching procedure. See, we are talking about the training here from the end. We are not talking about it from the very beginning, from the very start. It is something that is happening in the backward. We're talking about teaching mainly the last step and providing prompt uh, until the last step is reached. Then we're talking about teaching or training for the last two steps. Then we're talking about that last three and all. So the training is happening in the backward direction. It would always be backward chaining. A stimulus that signals the availability of reinforcement is defined as a. Okay, when we are talking about something that signals the availability, it is discriminative stimulus, which is ST. So we have the one with ST in only the third one. But let's complete the remaining MCQ. And a stimulus that signals the unavailability of reinforcement. Well, something that is signaling the unavailability, it would be stimulus delta. So our option C is the correct one. Sydney is working with her client Jack on a gross motor imitation skill, especially clap hands. Jake has independently clapped hands in the past and has imitated Pierce clapping. Every time Sydney presents the client do this and claps her hand, Jake will hold up his hands in front of Sydney, staring at her, and Sydney always completes the response for him. This illustrates an example of the skill is not in the client's repertoire, which means the client does not have the skill. We have seen that the client has independently clapped hands in the past. So this means the client had the skill, uh, but since the Sydney is clapping for him, we can see the client has developed prompt dependency because he's simply holding hands in front of Sydney and waiting for her to complete the response for him. So it would be prompt dependency. It is not behavior trap, it is not behavioral contrast. Which of the following is an example of prompting least to most? So we are providing the prompting of model and full physical. No, full physical can't be at the very start. It is not the least prompting. Well, gesture, yes, it is one of the least prompting. Then model, and then no, full physical cannot come before partial. Like partial is not the most form of prompting. Gesture, full physical and partial physical. Again, full physical should be at the end if given. So in this one, we are providing gesture first, least prompting, partial physical, and another least form of prompting, but then full physical, which is the most. So the least to most would be the D here. When Jessica is working with her client, when Jessica is working with her client, she ensures that she is always providing learning opportunities across different stimuli, various times of the day, incorporating new people and in teaching in different settings. What is Jessica programming for? Okay, so she's working with a client and she's providing opportunities for different stimuli, different time, different people, different settings. So she's basically programming for generalizing the skill for different environments, for different people. Sam sees a green ball and says green. Sam sees grass and says green. Sam also sees dark green leaves on a tree and says green. This is an example of. Okay, so Sam is saying green to everything, every green thing basically. So this would be uh, less. and the response is the same. If there would be different responses and to a same stimuli, it would be response generalization, but here we have different stimulus, so it would be stimulus generalization. It is not overgeneralization because he's saying green to the correct ones, and your client has been mending open door when wanting to leave the classroom, as he cannot reach the door handle. Later at lunch, your client needs help opening his chip bag and says, "Open door." Again, you observe your client mending open door when needing help opening his water bottle. This is an example of. Now, see the open door, he has generalized the same uh, words for different for opening different objects. So this would be overgeneralization here because the generalization is not correctly exhibited. This occurs when the client emits an unlearned response, which is functionally equivalent to the learned response. An example includes teaching the client to say hi, and you now observe the client saying hello and hey, which were not taught. So here you can see different responses which is basically based on the same thing. It's about greeting, but responses are different. So this would be response generalization. Your client has met mastery criteria for tying his shoes. This behavior continues to occur after the intervention being removed. This refers to, okay, so the behavior continued to maintain the behavior even when the intervention or when the training has been removed. So it would be maintenance of the mastered skill. Systematically and differentially reinforcing successive approximation to a terminal behavior is defined as, basically this is uh, operational definition for shaping in which every succession approximation is reinforced. So you have to simply go for the shaping one here. You're working with your client on two syllable echoics, especially say mommy. You reinforce your client saying ma. A couple of days later, your client echoes mama, and you then withhold reinforcement when your client says ma and only reinforce mama. What teaching procedure is being illustrated in this example? Okay, so what are you teaching here? Well, you are uh, again you are reinforcing on the successive reinforcement. You wanted to teach mommy, but at the start your client says ma. So you used to reinforce that, and when the client started learning mama, and you started reinforcing the successive approximation, which would again be shaping here. When using a token economy, which of the following is necessary? Identify backup reinforcers. What will be earned as a result of completing a token board? Yes, you need to have some backup reinforcers, like you are giving a client the tokens on doing the target behavior. But what else would you be providing when the client will have the tokens? You need to have some backup for that. Identify target behavior. Well, yes, you need to identify the behaviors for what you are using the token economy. Identify a ratio of exchange. Yes, you need to identify when you will be exchanging the token with the backup reinforcer. So all of the above will be correct here. This is a program during which the learner earns token contingent on appropriate behavior, but also loses two tokens contingent on inappropriate behavior. Okay, so when the client is losing something, losing the tokens or anything contingent on inappropriate behavior, it would be like the client has to give the response cost. He's giving the inappropriate behavior, So he will have to pay the cost, and he or she is using the tokens on this. So the answer would be the response cost. Ashley engages in frequent elopement. You are observing Ashley and notice that this behavior typically occurs as soon as she is asked to complete a worksheet at school. The teacher usually responds by telling Ashley, "It's okay, you don't have to work on it today." What appears to be the function of Ashley eloping? Okay, so we have to find out the function of the behavior. Okay, so again, there are four functions: SEAT, sensory, scape, attention, and tangible. So the one appears here would be scape. Which of the following reflects the main Which of the following reflects the main four functions of behavior commonly recognized in applied behavior analysis? Okay, so we talked about the SEAT. Remember that the sensory is also known as the automatic. So it won't be the first one because it has both the sensory and automatic in it, which are the same. Access, automatic, tangible, and scape. Again, access we don't, since there is also tangible, so access is not needed. Attention, automatic, scape, and tangible. Yes, this would be our answer because again in access, attention, scape, and tangible, the sensory one, the automatic one is missing. But here we have the attention, we have the automatic slash sensory, scape, and tangible. The three-term contingency refers to the three-term contingency basically is about antecedent, behavior, and uh, consequence. And for behavior, we also use the term response because response is basically a single thing, and when the number of responses, they are we're talking about the number of responses, it becomes a behavior, so it would be antecedent, response, and consequence. This term is used to describe what occurs immediately before the behavior. When you're talking about something before, it would be antecedent. When you're talking about something after the behavior, it would be consequence. Response could be the behavior itself, and attention is or can be the function of behavior. So something that comes right before would be the antecedent. This term is used to describe what occurs immediately after the behavior. So, as we talked earlier, consequence is something that happens right after the behavior. Your client often makes inappropriate jokes at the clinic. At the clinic, you notice that when he does this, most of the kids around start laughing at him, increasing the likelihood that he will continue to make inappropriate jokes in the future. What appears to be the function of this behavior? Okay, so something is happening not automatically, but because of the kids laughing around the person. Okay, so it's not sensory or automatic thing. The client is not trying to escape here. Instead, he is trying to get involved and make jokes, etc. So it's not escape. Attention, well, yes, the client is getting attention from the kids around him. So he's making the jokes more often in future. So it would be attention thing. And no, there is not the access to anything is needed here. The answer would be attention. A dash decreases the value of a stimulus as a reinforcer, and a dash increases the value of a stimulus as reinforcer. Okay, so something that is decreasing would be something that is abolishing something. Abolish actually means the decreasing something. So abolishing operation would be decreasing. Meanwhile, establish. When you are establishing something, you are making something. So the increasing of value would be the establishing operation. So our first one would be the correct answer. And again, this is also the operational definition. Jill yells at loud volumes. Jill yells at loud volumes to get her mother's attention. Her mother reinforces close approximation to low speaking volumes and tapping her to get her attention and ignores the loud volume screens. The process of reinforcing appropriate responses and withholding reinforcement for inappropriate responses is an example of where uh, here we have approximation. We're talking about reinforcing approximation. It could be chaining, but something is also asked with this one, that is withholding reinforcement for the inappropriate. So it is not chaining. Uh, Differential reinforcement, yes, this would be differential because we are reinforcing the correct ones and we are not reinforcing the inappropriate response. So it would be differential reinforcement here. Your BCBA is using a differential reinforcement procedure to teach a replacement behavior for a client tantruming during independent seated work. The function of the behavior is escape. What replacement behavior would be most appropriate to teach in this scenario? On task behavior. Well, no, if the client is trying to escape, he is definitely trying to escape the task as well. So it won't be appropriate to teach more on task behavior. Asking appropriately for access to toys. No, there we are not talking about something. We're not talking about the toys, whether he or she wants it or not. Requesting a break. Yes, the client is trying to escape already. So if you tell him to request for a break, it would be an appropriate replacement behavior of escape. Again, playing with sensory toy or access to toy won't be needed here. Your client continually engages in out of his seat behavior in the classroom. A desirable behavior with roaming around the classroom is being seated during class time. The teacher therefore could reduce the out of seat behavior by reinforcing the child for being seated. What differential reinforcement is used or being illustrated here? Okay, so we are talking about reinforcing the behavior of on seat, uh, and then we are talking about. So we're talking about reinforcing when the children are being seated. So if they are out of seat, we won't be reinforcing them, which means we are differentially reinforcing incompatible behavior. Like we will be reinforcing only when the person is seated, and for incompatible behavior, we need the behavior cannot be done at the same time, like the child cannot be seated and cannot be roaming around the classroom at the same time. So the teacher reinforce is using DRI here. Your BCBA is teaching you how to implement an extinction procedure. The goal is decrease property destruction. What could be true when implementing extinction? Extinction is rarely effective. Well, no, extinction can be most of the time effective is if done correctly. Extinction should be implementing at least 50% of the time. No, it has to be done 100% of the time to be done perfectly. Ignore the child and turn your back away from them to limit attention. Not at all. There's a difference between ignoring the behavior and trying to extinct the behavior. Maybe the client wants to continue doing it. The function of his behavior might not be attention, so limiting attention won't do any much difference to him or her. There could be an immediate increase in property destruction at first. So yes, there is a term of extinction burst whenever we are trying to implement extinction procedure, and in that the behavior could increase exponentially before decreasing. So it is kind of an obvious thing to face the extinction burst or the increase in property destruction here. Your BCBA determined that attention is maintaining Jack's aggressive behavior. What could extinction look like in this situation? Reprimanding Jack when he engages in property destruction. No, if you are reprimanding him, the attention is given. So this could increase again. It won't be the extinction of behavior. Withholding attention while Jack increases in aggressive behavior. Uh, well, yes, you have to withhold attention. So this could be a helpful thing in decreasing the behavior. Giving Jack attention no matter what behavior he's engaging. No, if he's engaging in aggressive behavior, you can't give him attention. It would increase the behavior and it would be withholding attention. When working with a client who you are aware that engages in hair pulling, what is an antecedent strategy you could implement? Antecedent means you have to do it before the before the start of the session. Wearing your hair up, yes, to avoid. Yes, so the client won't be able to reach your hair. Carrying a hair tie with you, yes, because the child is already engaging in hair pulling, so you have to keep a hair tie with you in case the client before the session, after the client grabs your hair, he call for help. Well, this is our consequence strategy. We are talking about something we can do before, so it would be both. It would be both A and B. Which of the following example is an appropriate scenario? Implement a restraint safety care procedure as an RBT with a client. Okay, so anytime your client engages in aggressive behavior, we don't know the intensity of the behavior. It could be too less to implement a restraint or safety care procedure. But when it is written in the behavior intervention plan and you are trained to do it, then you should be implementing it. For session at the start of your session, your client's mother inform you that he started a new medication and has been engaging in severe head banging and ask your advice on how to handle this behavior. What should you do in this scenario? Okay, so remember that if there is some significant change in client's routine, like a new medication, like sleep disturbance, like any sickness or anything, you need to report it to your BCBA. You need to inform your BCBA in this situation. So let's go through the answer here. Through the options here, tell the mother you will look up ideas on the internet and get back with her on how to handle the situation in the moment. No, that is extremely a false approach. Inform the mother that you will contact the BCBA as soon as possible as it is out of your scope of practice. Yes, you are required to share this with your BCBA and he or she will be guiding you here. Inform the mother to discontinue the medicine until the BCBA comes to the home next week. Again, you cannot ask to continue or discontinue the medicine. You need to consult your BCBA ASAP. You're working. Okay, so I accidentally selected it and forgot to record your but let's go through it. You're working with your client when the client's father inform you that he does not want you to implementing natural environment training, but it is written in the skill acquisition plan to incorporate NET. The father states that from here on out he only wants you running programs at the table and implementing discrete trial training. What would be the best course of action to take in this scenario? Again, you cannot start anything by yourself, you cannot stop any plan by yourself. You need to consult with your BCBA. He or she is in charge of implementing, he or she is in charge of creating or modifying the plan for your client. So you have to inform the father that you will notify the child's BCBA and the BCBA will further continue or proceed with them. When writing a session note, you should do all of the following except use objective language. Yes, you should be using very objective language, not giving your opinions or uh, giving any subjective opinion on that. So you are not required to use subjective language. You are required to write in measurable terms because that's what a behavior is, or that's how you are required to do data collection in ABA, and you need to write professionally, obviously. So you are required to avoid using subjective language. When writing a session note, all of the following are required component except session date. Yes, it should be clear. Session time should be clear. Note must be clear, complete, and concise. Yes, all of the above are required when writing. Absolutely. Which of the following best illustrates an appropriate example of an RBT communicating to a parent at the end of a session? So remember, whenever you are communicating to a parent, you are required to avoid using jargons, avoid using technical terms, because you have to communicate in the most understandable language with the parents. So his day was good. BCBA changed his reinforcement schedule from FR1 to VR3, etc. Again, technical answer no. He had a bad day today. He did not play with any peers. Whined when more tasks were presented. BCB plan is not working. Again, a very subjective communication strategy. This is not the correct one. We worked on tying shoes independently today. She needed minimal assistance when tying the laces, but was successful at putting on her shoes and socks independently. Well, this is a very good example of communicating with a parent. He was really mad today when transitioning from gym and all. Again, he got angry and uh, calmed down, and all these are again very subjective language which we are required to avoid. At a minimum, how many years do client data and records need to remain secured at an organization? Okay, so this one, remember that it is BCBS requirement or code of in ABA it is like the code of ethics that we are required to maintain the data and record for 7 years at a very minimum. At a minimum. Which of the following is the most secure location an RBT can store confidential documents between sessions? Remember, you have to keep them locked no matter what. You can't keep them open. You can't keep them in backpack, in car console, in a folder in the car. No, these are not the correct answer. You have to keep them in a secure bin locked in the trunk, as this would be the most secure location to store the confidential documents. You're arriving for session and your client's neighbor asks you why you are always at their house every day at 12 p.m. How should you respond? Tell them that you provide ABA services. No, you cannot disclose this information about the because you are doing something for your client, and you cannot disclose that the client is receiving ABA until unless the parents or the client does not want it to be disclosed. Tell them that the company you work for and provide them a pamphlet. Not at all. Again, you are disclosing the service the client is getting. Inform that you cannot disclose this information. Exactly. You cannot disclose this information to them, or tell them that you work with your neighbor's child who's diagnosed with autism. Again, these informations cannot be disclosed to maintain the client's dignity. When is it okay for an RBT to post a client on social media? Okay, remember this. It is never okay for an RBT to post a client on social media. So the one here, an RBT should never post their clients on social media. It's not about when the client have mastered any skill. It's not about when the client When you want to congratulate your client, it's not the both, it's just that you are not allowed to post your client's picture on social media. Which of the following examples illustrates maintaining client confidentiality? Only discuss client information that is relevant to the services being provided. Yes, you should be. Only discuss information for professional purposes and with relevant people. Yes. Do not share or discuss identifying information with individuals outside of the client's treatment team. Yes, you should be doing this. You are not supposed to share information with the other people who are not part of the team. So, yes, all of these would be the true to maintain client's confidentiality. Which of the following examples best illustrates maintaining client's dignity? Sharing with others RBT what medication a client is on. No, you are not required to or allowed to share this. Discussing with your friend personal information about your client. No, you cannot do that. Also, ensuring you are protecting your client's privacy in the clinic during toilet training. Yes, this way you can maintain uh, their dignity because you are protecting their privacy also. So this would be it. And no, you cannot restrict their access to food or water. Which of the following is an important part of an RBT's role? Conduct a functional analysis. Well, it is a part of, but you have to do that under the supervision. And supervise new RBTs. No, you cannot do that. Only a BCBA or a BCAPA can do, only the BCB can do that. You cannot solicit testimonials from current clients. No, you cannot do that also. Treat clients with dignity and respect. Well, this is the most important part of your role as an RBT. As an RBT, you can do all of the following except assist with training of stakeholders only under close supervision with a BCBA while you are under the supervision. So yes, you can assist the stakeholders training, implement programming with the client when the supervisor is not present during session. Well, yes, you can implement the program because it is created by the BCBA by your supervisor. Qualified to change the skill acquisition plan when you notice a program is not effective. Not at all, you are not qualified to create or change, modify the skill acquisition plan, so you are not allowed to do this. And you can do all of the above. No, you cannot do all of the above as an RBT. When receiving feedback as an RBT, you should do which of the following? Respond by implementing the feedback and asking questions when needed. Yes, you should be doing this. You should try to implement the feedback. You should be able to take the constructive criticism, and you should be asking the questions when needed. Get defensive and defend yourself. No, this way you would be uh, stopping your own learning. You're stopping yourself from learning more. So you are not supposed to get defensive. It's also against the code of ethics. Do not implement the feedback when you do not agree with it. No, if you don't agree with it, ask the questions and clarify yourself. So all of the above is not the answer, but instead you should be implementing the feedback. But an RBT is working with a client whose mother asked her for advice pertaining to their child's diet and supplements they are asking. The client's parent is worried that it is affecting the behavior and analytic service being provided, which best describe the course of action the RBT should take. Again, we are talking about diets and supplements, like we are talking about the medicines and all. So we need to let our BCBA, our supervisor, know, and the option with the BCBA one is the second here, that the RBT should let the BCBA know and refers the parents to the BCBA, because only the best course of action here can be described by the BCBA. It is written in the child's behavior intervention plan to implement least to most prompting, but the client's parents specifically state that they want you to implementing most to least prompting instead. As an RBT, what should you do in this scenario? Again, it's about modifying the plan. So you cannot create or modify it. You need to know your BCBA. So you will be informing the parents that you will let their child's BCBA know this and they will reach out to them. A client's family asks you to babysit over the weekend while you A client's family asks you to babysit over the weekend while they go out of the town. As an RBT, how should you respond to the parents' request? Well, they are asking you to babysit, which is out of your services. You are working as an ABA therapist, so you cannot be doing this. So you will apologize and inform the family that it is against the RBT's ethics code. You are an RBT and receive a friend request on social media from your client and your client's mother. What is the best course of action to take in this scenario? Uh, you cannot accept friend request from your clients or your clients' parents because this way the professional work environment would be affected. So do not accept either friend request on social media to maintain a professional work environment. Which of the following illustrates maintaining client dignity? Respecting cultural differences, yes. Only sharing client information with stakeholders and supervisors, yes. Protecting your client's privacy, yes. So, all of the above would be good examples of maintaining client dignity. Which of the following illustrates an example of a dual relationship? Behavior analysts are truthful and honest. No, this is not dual relationship. A situation where multiple roles exist between a client and a service provider. Yes, this way, dual relationship is existing. Obligation to take reasonable precautions to protect confidentiality while it is not dual relationship, and promoting an ethical, cultural, and work environment. Again, these are the good examples and are not an example of dual relationship. But if there are multiple roles existing between a service provider and a client, it would be dual relationship. The client is collecting ABC data each time a client hits a peer or staff with open palm. What functional assessment is being described in this scenario? Okay, so you are mentioning the ABC data, directly with the client, and mentioning we are recording the data each time he or she is hitting the client. He or she is hitting the staff or peer, so you are taking the measurement directly from the client. Why is it important to collect ABC data? Because you need to find out what happened before the behavior, what the behavior was, and what happened after the behavior. So it can help determine the function of behavior. Yes, you can find out why the behavior occurred by looking at the consequence and antecedent of the behavior. So this way you can find out the function of the behavior. And next one is before the onset of services, the BCBA informed the RBT that they conducted an interview with the client's parents and gave them a questionnaire to fill out about their child's preferred activities. This is an example of which functional assessment. Okay, so when we are dealing with the client directly, we are taking data of the client's behavior and all. We are doing the direct measurement, and if we are conducting the interviews and if you are taking the data with the stakeholders, with the client's parents and all, this way it would be indirect observation, as we are not directly involved with the client and we are giving them a questionnaire, conducting an interview and all. Johnny's dad reprimands him for not cleaning his dishes after dinner. The next day, Johnny cleans his dishes and his father immediately stops yelling. Johnny is more likely to clean his dishes in the future. Okay, this is an example of, okay, so he is more likely to clean his dishes. Again, this is something, well, uh, the future probability is increased, it would be reinforcement. And okay, so the yelling is being removed when the when Johnny cleans his dishing. So something which is being removed and the future probability of that behavior is increased, it would be negative reinforcement. Which of the following is an example of positive punishment? Okay, so positive, which means something is added. Punishment, which means example of positive punishment. Positive means something is added, and punishment means the future probability is decreased. So, which means the person is getting something, and as a result of that reinforcement, the future probability decreased. So here the first one, a student lost a token each time he left the class without permission. Okay, he's losing something, so it is something negative, but we don't know whether he stopped doing that, stopped leaving the class or not. Dave received a speeding ticket, which decreased him speeding in the future. Okay, so he received something, something was added, so it is positive, and we have clear evidence that the behavior of speeding decreased. So punishment was served. So basically he was so the basically the positive punishment was given here, and it is clear from the evidence. It could be the answer, but let's go through the all. Each time the child hits his brother, the mother removed his favorite toy, which decreased him hitting his brother in the future. Okay, so mother is removing, which means it would be negative punishment. So we are talking about positive one here, so it would be the Dave one. Let's submit it and see the answer. Thanks for submitting your response. You scored 85 out of 85. So all our answers are correct. You can also try this mock exam and write your scores in the comments. Thank you so much for watching. In the next videos, we will also be covering different concepts and topics of ABA. Stay tuned. Thank you.